So essentially, there's going to be three areas that we're going to see the most consequences if we're not implementing technology and becoming innovative. So the first one is going to be safety, the second one will be satisfaction, and the third will be equality. So what do these words mean? Safety basically means that if we're not utilizing new evidence-based practice, we're not implementing it into the day-to-day tasks that we complete, patient safety will be at risk, because the only way that we increase patient safety or maintain it is by constantly challenging our practices, what it is that we do, how can we better the environment so that it's safer for the patient. So without implementing these things, patient safety will be that first setback automatically. Simple things like if they're a fall risk patient, it is evidence-based practice that we should put the bed alarm on. If that wasn't something that was implemented, then naturally patient safety is at risk. The second one that we would see a definite consequence in if this technology wasn't utilized would be patient satisfaction and even peer satisfaction, right? So there's a lot of different things that can be given as examples for this. Essentially, if you are a doctor or a nurse and there is a better vital signs machine or there is a better tool for surgery, if you know that there are better tools and yet your organization or your hospital doesn't want to invest that extra step in this newest technology, it can often frustrate individuals, resulting in decrease in worker satisfaction. This translates as well to patient satisfaction because, it's easier to go through the admitting process if there's fast technology, fast computer systems, versus having to write your entire medical history down with a pen and paper. So it's simple things like that that can result in either increased patient satisfaction or decreased patient satisfaction. So technology really helps maintain this, and if it's not utilized, then obviously this is a consequence that we see. So far we have that patient safety is put at risk, both patient and worker satisfaction can be compromised if we do not effectively use technology, and the final one is equality. Now, this is an interesting word because a lot of people don't have a tendency to think about this, but basically, if we're not seeing what is the best way to approach something, who is the best person to utilize, man, woman, nurse, doctor, depending on the situation, we can really have this be a consequence of not implementing technology. If doctors are used to working on their own and refuse to have the nurses really work alongside them or implement something, that equality all of a sudden is pushed back. And now you're starting to see leadership break down because of individuals not being able to work together. This is a form of technology and being innovative. If doctors can realize that sometimes nurses are the best approach, and sometimes nurses have to realize that doctors are the best people to deal with this, that's when we start to see organizations become more innovative because they're able to recognize when and who is needed. So these three things are some of the consequences that can occur if technology is not implemented, but it's also some of the benefits that we see if it is properly implemented. So in the following rest of the presentation, we'll focus on the methods of integration and how we are going to see this in our day-to-day practice.